Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I'm Dr. Linda Snetselaar, Editor-in-Chief of the Journal, and today we are focusing on an article for this particular podcast, which is titled Equity-Focused Federal Child Nutrition Program Policy and Response and Recovery Efforts in Times of Public Health Crisis. And I'm very excited today to be interviewing Dr. Juliana Cohen, who is an associate professor in the Department of Nutrition and Public Health and director of the Center for Health Inclusion, Research, and Practice in the School of Health Sciences at Merrimack College in North Andover, Massachusetts. Welcome, Dr. Cohen.
Thank you so much. It's really a pleasure to talk with you.
So I had just a few questions related to this particular article. And the first is, please, could you provide a summary of how the pandemic has affected federal child nutrition program policy?
Absolutely. So just to give everyone just a very quick background, the U.S. Department of Agriculture's child nutrition programs includes the National School Lunch Program, the School Breakfast Program, as well as Summer Food Service Program, and then the Child and Adult Care Food Program. And these are programs that provide meals and snacks to millions of children throughout the United States every single day to promote children's health as well as educational readiness. And so during the pandemic, the federal child nutrition programs issued multiple waivers, which allowed flexibilities in how these programs were implemented, as well as expanding their scope. So, for example, with schools, one of the most important policies we had was temporarily implementing healthy school meals for all, which means that all children who are attending public schools could get meals for free at school regardless of their household income. For summer feeding program, there was a number of different things that the USDA allowed. First, they allowed summer meals to be served in what's called a non-congregate setting. So this means that students no longer had to eat meals at the specific summer meals site in a group setting. Another thing that they did is they allowed sites to provide families with multiple days worth of meals to be picked up at one time, rather than a child having to go repeatedly to a site for breakfast, then separately for lunch, or every single day throughout the week. And then additionally, they waived something called area eligibility requirements. So this allowed more school districts to provide meals to students from lower income households, including those that were living in higher income areas that normally can't provide these meals. And then also families were provided with summer pandemic EBT cards as kind of temporary emergency benefits for eligible families to purchase foods. And then lastly, with CACFP, that Child and Adult Care Food Program, they increased the reimbursement rate for programs, as well as allowing grab-and-go meals to help support family, and then also expanded it to allow young adults up to age 24 to be eligible if they were homeless or at youth-serving shelters.
Thank you. Very, very nice definitions. And I wondered to drill down just a little further, more specifically, what has the impact been when we look at health disparities and nutrition equity?
That's such an important question because we saw that during the pandemic, families with children were particularly vulnerable. And we saw that the prevalence of food insecurity among households with children rose substantially. And additionally, food insufficiency, which is sometimes or often not having enough to eat, also increased among households with children during this time period. And what's also really important to note here is that this disproportionately impacted families that were racial or ethnic minorities. So, for example, Hispanic children were more than twice as likely to live in a food insecure household compared with white children. And Black children were almost 3 times more likely to live in a food insecure household. But encouragingly, many of these federal child nutrition programs implemented were really focusing on kind of nutrition equity and access to meals for these vulnerable populations. And also really important is that this pandemic has really helped to shed light on these nutrition disparities. One thing that's really encouraging is that the current administration has really highlighted that nutrition equity is a priority. So, for example, there was the recent White House Conference on Hunger and Nutrition and Health, and a major focus of this is around developing and catalyzing a coordinated strategy to help address hunger and improve nutrition and reduce these diet-related disparities. And a lot of this can be done through these child nutrition programs.
So, sort of in keeping with what you've been talking about, and I have always wondered about this, are there nuances of nutrition program policy that actually differ from other federal policies? And I'm assuming yes, and wondered how do they differ?
So one of the things is really this focus of with child nutrition programs really around, not surprising, this focus on child nutrition and nutrition equity. But there's even really an interesting historical context to these programs as well that kind of highlights some of these nuanced differences. For example, interestingly, the National School Lunch Program was actually developed as a measure of national security, in part because so many people were being rejected from the draft during World War II due to malnutrition. And now we're actually facing a similar problem, but with overnutrition, with so many ineligible to serve due to obesity, which is in part why the military actually supports such strong standards for school meal programs. But overall, as a result, what we see with these child nutrition programs is that they're really multifaceted. Not only are they focusing on food insecurity and child nutrition, but also to improve nutrition equity and academic equity, plus while supporting domestic agriculture and national security efforts. And it's all these different nuanced goals that really make child nutrition policies quite different from other federal policies as well. And while these are all political issues, supporting children's nutrition is something that really crosses party lines too when we think about policy decisions. Everyone really agrees that the health of our nation's youth is absolutely critical. And, as I mentioned, even the military supports strong child nutrition programs. And so really with child nutrition programs, the focus is really on, how do we best support child nutrition? And from that, there's a lot of lessons that we've learned from the pandemic.
Yes, and given the public health crisis that we just went through, what are your thoughts on how we recover relative to federal child nutrition program policy?
So there are definitely many strengths to these programs already, but as you noted, the pandemic has, really highlighted the need to further strengthen child nutrition program policies for school-age children, but also to think about, well, how can we shift to kind of more sustainable and permanent policies and programs that really target the root causes of structural inequities that we see here. And one of the most important things that we could do to improve equity of access to all child nutrition programs is really thinking about how can we better consolidate all these different applications and certification processes across child nutrition programs as well as SNAP, to really ensure that children have continuous access to all the eligible nutrition assistance programs, and really reduce the burdens of all these different separate application processes for each program. And then when we think about the different kind of specific child nutrition programs, first thinking about schools, universal free school meals is one of the most important ways that we can expand access to school meals on a daily basis, as well as reduce stigma. Interestingly, research has found that when school meals are provided to all students, It increases participation not only among those who previously weren't eligible for free meals, but also among children from lower income households that were already eligible, which really highlights that there's so many barriers and stigma to receiving school meals when they aren't available for free to all students. Additionally, policies like breakfast in the classroom can reduce barriers and stigma associated with breakfast. It can be really challenging for many students to get to school early, or stigmatizing to be those children that are eating separately in the cafeteria before school, as well as just ensuring kids have enough time to eat school meals. There's currently no federal policy to ensure that kids have enough time to actually eat these nutritious meals that we serve. And the government has already been doing a great job with kind of grants for equipment and infrastructure and training for cafeteria employees. So really continuing with these targeted grants, as well as really thinking about how we can further emphasize culturally appropriate food options for different student populations. And then when we think about summer feeding programs, there's already some emerging evidence that suggests that these non-congregate settings, so again, no longer requiring a child to eat on site, really can improve participation and access, along with allowing kids to be able to receive multiple meals to be picked up at a time. And then also continuing with those expanded area eligibility requirements, so more districts can continue to provide meals to students. And thinking about that continuation of the pandemic summer EBT policies as well, to really ensure that families are able to provide for over the summer when they no longer have access to school meals. And then when we think about CACFP, really thinking about opportunities to continue that expanded eligibility. Again, those young adults who are homeless or in youth serving shelters, but also this pandemic has highlighted how important those higher reimbursement rates are for CACFP to ensure that we're providing the most nutritious options available for families. And also thinking about opportunities when children are in full day care, child care, to also receive afternoon snacks or suppers. This could really increase healthy options for children, and also thinking about reducing chronic stress for parents as well. And then lastly, what we've really discovered is that there's a lot of data lacking, specifically for CACFP. There's not currently a database that exists that really enables us to be able to examine the impact, to ensure that all these different vulnerable populations are connected to the needed services, or look at outcomes like food security linked to participation. So there's really a number of actions that we can be taking to continue with many of the policies that we had during the pandemic, as well as expand them, which have strong potential to help address nutrition equity in the United States.
Thank you. Such important details, and so important, I think, to identify barriers, which is something that you've been doing, which is really marvelous, I think. So, how do you see these kinds of policy shifts affecting what the practicing registered dietitian nutritionists might be doing today with her clients?
So we know that they're just playing such an important role in children's nutrition and household nutrition. And the policy shifts that we've seen have really further highlighted just how important their role is in promoting children's nutrition. It's been really exciting to see the potential of these programs to help address food insecurity, nutrition equity. And it's so clear that RDNs play a vital role in supporting these families as well. So on the individual level, thinking about ways to continuing to support their needs in culturally appropriate ways, but also thinking about how they can further connect families and children with these child nutrition programs to really help support them and their nutritional needs. So really overall, this really represents a key opportunity for us to learn from the COVID-19 pandemic, and to really think about how we, with RDN support, can further support children as we recover from the pandemic.
Yes, well, thank you so very much for providing your thoughts on what I think is a crucially important topic. I do believe that your ideas have the potential to impact health disparities and certainly nutrition equity. And I wish you the very best in the research that you continue to do in this important area. Thank you.
Thank you so much, and thank you for the opportunity to talk with you about this.